New Age Parenting, presented by Neelkant IVF Hospitals. We have the experience. Powered by Psychorian Matrimonial, Ek Rishta Vishwas Ka.
Hello and a very warm welcome to New Age Parenting, and thank you so much. We've received tremendous response for the last episode. Yes, a lot of emails and a lot of phone calls. We can understand that this is your platform and you really want a lot of more information. For that, we would be having Dr. Bindu Garg once again for these 2 episodes. So let's move over to Soul Searching. In our soul searching segment, as promised, today once again we have Dr. Bindu Garg, infertility expert from Neelkant Hospital. A very warm welcome to you, ma'am. And thank you so much for taking our time. Last episode, so many people have called, we've received so many emails and people have been thanking you. We've always talked about, that of course the physical problems which are there. But how about the emotional blocks? You said last time counseling plays a very important role. What kind of counseling is there and what kind of emotional blockages most of the people have?
See, the very interesting case, we got a call after this episode. My counselor got a call. Madam, I was sitting at home and with no hopes now, and I had given up all the hopes of going. I didn't want to go to a doctor, but after listening the program, now somehow I am feeling that I should again go. So she has taken an appointment. So this is exactly how you feel, that you should not create a negative aspect into the lives. That, see, we can't do, you can't do 100%, but still counseling them and just counseling that, try again, don't lose heart, but till the doctor tells you yes, that, see, ultimately you have to draw a line, and we have to make them realize that it's high time they should stop going to a doctor, because that's also a trauma.
Going to a gynecologist
yeah. Every time getting up in the morning, and the very fact now today again, the you have to, even the taking a chutti from the office, then making the whole schedule, changing the whole, that's also very traumatizing.
So what is the time where we should realize that we have to meet an infertility expert? What should be that time?
See, there is no particular time, but yes, you should know the problem. That if my problem needs an immediate treatment and needs an expert treatment, then yes, earlier the better.
Once they've started the process, suppose of this, they've gone to the infertility expert and they've been trying, because then they become quite impatient.
Yes.
Because they've already gone through a lot. There is social stigma, there is emotional upheaval, and there, I think, some hormonal problems also must be there. That is why they are not able to conceive, and a lot of that kind of trauma is going through, and then they want miracles to happen.
You can't do miracles, but yes, we start investigating them in an ethical and in a proper protocoled fashion. Like, suppose we always test the males first, just to realize, yes, always the semen analysis. I do first the male partner evaluation, just to rule out that the semen is normal on the male part. Once we rule out that, then we do the set of investigations on the females, and the basics are, we do a day 2, second day or day 3 hormonal, the blood test, to know what is the hormonal evaluation of the patient. Then we check the tubes, which is normally done with a very, it is called an hysterosalpingograph. It's just an X-ray which is done maybe under local anesthesia or maybe under general anesthesia. We give an injection ketamine if it is very painful, and then we do an X-ray to check the tubes. If the tubes are normal, if the hormones are normal, then we don't rush to IVF immediately. There are simple process like intrauterine inseminations, and suppose the fault comes with the tubes, then we try to open the tubes. So what the investigations tell us, according to that, we take a decision about what is to be done next.
Another thing which I wanted to ask is that even if it's the male who has a problem or the female, even if the fallopian tubes are blocked or the the quality of the sperm is not that good, is it a disease?
It's never a disease. It is just that you are having a problem. The disease, you can't call it as a disease. The things is that
these are the mindsets which are there in people.
It's not a disease, but yes, you have infections. You can call it as a disease or you can call it as a problem, but solvable problem.
And what are the reasons for this? Do you have the reasons for this? Is also a lot of emails we have got that blockage of the fallopian tube.
Blockage.
Is it there is some some upbringing fault, somewhere they have made a mistake, or something genetic is there?
The main thing is the infections. In India, the main infections is tuberculosis. Tuberculosis, but if detected at an earlier stage, and if the tubes are, if you give the anti-tubercular treatment, sometimes these tubes they start functioning. But if the disease is so prolonged and the side effects of the tubercular bacteria on the tubes are there, then they get blocked. And then there is a condition which is called as hydrosalpinx, when the tubes get blocked and then they get dilated. That is, if the females has reached to that stage, then you can't do something. Then
and
you
that
can't
also
do
is the reason.
That is the main reason.
Tuberculosis.
Yes, and other reasons are the normal infections, poor hygiene, use of all these contraceptive devices. Sometimes you must have heard that they didn't have any problem in conceiving the first child, but the second time, no, they are not able to conceive. And if you take a history, there's history of intrauterine devices just for a contraception. Sometimes they also cause, but main is the infections. Now infections can travel from many places. Sometimes there is no cause.
When there are 2 or 3 abortions,
yes,
then the pregnancy, again becomes a very major problem.
Yes. And the major problem that comes is with the lining of the uterus. Suppose they say that we got it done over there and then we have a problem. So they blame sometimes the doctor. The doctor did it. We always tell them it is not the doctor, it is the side effect of a procedure. So if you don't want a baby, use contraceptions instead of having a pregnancy and then getting it aborted. So you should space your children, but not resort to the abortion because it's an early or it's an unplanned pregnancy, because sometimes these abortions they cause infertility.
Mother has a tendency of abortions. So do you work on the abortion part first, why the abortions are happening?
Yes, exactly. And this is called as a bad obstetric history, and there is a complete set of investigations. We call it as a BOH panel. We test everything because we don't want that once you treat the patient and then she aborts. So we go for all the tests, that if anybody is having, they can always contact any of the doctors, and once we feel that next time that yes, she is a fit case, now she should go for a pregnancy, then we advise her.
And how about the male infertility? What are the reasons for that?
Male infertility, see, there are 2 things. Either the sperms are not there, or if they are there, they are less. If the sperms are not there, that's entirely a different book and an entirely a different different chapter. But if the sperms are less, the common faults, which is the lifestyle, smoking, alcohol, other stress factor plays a role. These environmental conditions, they play a role. Occupational hazards. Suppose you are working in a place where there's a lot of heat, wearing tight pants, wearing tight clothes, some operations, injuries. So there are fevers, high grade fevers, sometimes they cause this male infertility, but again it's not a disease, it's a treatable condition depending upon the cause.
It's only a condition.
It's only a condition,
which can be treated, or at times may not be treated.
And we have now the latest so many methods. Even if the sperms are less, they can always resort to IVF.
And what is the reason for no sperms?
No sperms, say viral infections in the childhood, mumps, and the history of there's a condition called as undescended testes in the childhood, when the testes are there in the abdomen and it is undetected. So by the time you replace them at their usual position, the sperms are already, the germ cells which make the sperms, they become dead. But main is the mumps, virals, and then there's a genetic defect. If you test them academically, there is a fault, genetic defect in somewhere in the gene, Y genes.
Dr. Bindu, in soul searching, we've really realized, there are a lot of things which, a lot of thoughts about this whole process. And of course, one, there is hope. But one, there were a lot of these questions, which people had. And we've been receiving a lot of calls. So time now to actually move over to Mythbusters. In Mythbusters, once again, we have the privilege to have Dr. Bindu Garg, who is an infertility expert in Neelkanth Hospital. Dr. Garg, we have received so many mails, but this mail I really wanted. He has not written his name, but he says that he's been a juvenile diabetic and he's been now married for last 10-12 years. He has got one child, and that was normal. He says that was normal because in the beginning only we had this baby. But when we tried for the second baby and we realized that it was not happening, the wife was not able to conceive. And then there was, because of being a diabetic, in fact he has been a diabetic now for the last 30 years, is that there's not that much urge is there, and impotency definitely plays a major role. And he wants to ask is there that my manhood reduces? Another lot of people have this very subtle questions, that if my sperm count is less, if I don't have sperms, the way like we were talking about, does it really mean that I'm not a man anymore?
No.
I mean,
it's a big myth. But see, manhood, what is the parameter? So you can't define that this is manhood. The sperms count, motility and a manhood, according to me, they are two different things. You don't lose your manhood, but see, since he's a diabetic, so diabetes is one disease which causes, if it is uncontrolled, which causes all these problems. So basically he should be in regular touch with his endocrinologist, who will guide him the actual treatment. These people are already on insulins. Maybe his doses are changed, so he should go to the doctor and see if his diabetes is controlled or not. He's already got a child, so we don't expect the sperms to become nil. If the sperms are not nil, then he should get the wife also checked up. Maybe some problem has occurred in her also. So basically we check the tubes and her hormones also. If we find both of them normal but the sperms count are less, then there are other methods they should resort to.
Another myth which a lot of people have asked us is that the child who is born through these procedures, is he a normal child? Because because people have this misconception that will he have some problems? Will he be detached because he'll not be a loved child? He hasn't come, even if it's our sperm, our egg, it's not the loved child. So will he be detached from us? Will the mother not be able to take care of the child?
I think it's the opposite. Since it's a truly blessed, and after so much of efforts, so that child is a more precious and more cared in the not that other childs are not being cared, but it's the other way around. Once the child is born, it's never, no couple, if you ask them, they never feel it's an IVF child, or it's even through a donor or even through a surrogate, because the whole family environment changes. I feel it's the opposite. They become more close to each other because they spend more time with each other once the child is there. And you must have seen the husbands, they're coming from the office. They don't spend so much of times working hours, because then you have an incentive to go back to the house and play with the child.
Yes.
I feel it's the other way around.
And they've really made a lot of efforts to create that child actually.
And there is another what the old women say, that once the child is born like this, sometimes they conceive on their own. And so many instances they adopt a child, and after 3-4 months only the couple conceives. It is because that stress is gone. They feel more happy. They are together. I mean, they spend more quality time with each other, and the natural conception happens.
And this has also happened.
Yes.
That while first child can be the
after the adoption, after IVF, after that there can be many times a natural conception. We have seen so many cases.
Very true. A lot of myths getting actually solved on this platform. Dr. Bindu, at this juncture, we'll take a short break, but we'll be back soon with Mapping the Conflict. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh.